If you are considering dental implants, then the next few minutes will be time well spent. So sit back and get ready to learn 5 important facts you need to know about dental implants. If you have experienced some sort of tooth loss, well, then you're not alone. According to a study done by the U.S. Surgeon General's office, almost 70% of adults have lost at least one permanent tooth, and close to 30% of all people have lost all their permanent teeth. This according to the American Dental Association. If you are suffering from tooth loss, then I don't have to tell you about how it feels. If you have dentures or partials, then the problems compound. Dentures and partials often slip or make clicking noises when you talk or eat. This may often make you feel insecure or embarrassed while speaking in social situations or while dining out. Also, not addressing a loose tooth causes adjacent teeth to shift and move and worsen the possibility of falling out. Before you know it, your one missing tooth turns into several missing teeth. What you may or may not know is there is a solution. Dental implants. Dental implants are now considered the standard of care for tooth replacement. Fact 1. Treatment options such as standard dentures and bridges actually accelerate bone loss, giving you that sunken-in look. Not so with dental implants. Clinical research shows that dental implants may actually help to prevent or slow bone resorption, helping to preserve both your appearance and your overall health. Fact 2. Dental implants are the most advanced therapy available to replace teeth. Also one of the most reliable. Single-tooth implant success rate is above 98%, while implant-supported bridges or dentures have 95% success rates over 10 years without the severe loss of supporting bone. Fact 3. Dentures shift from side to side during chewing, a significant problem that new denture wearers often complain about. This is something they must get used to and accept. Worse yet, denture wearers have decreased nutritional intake due to this problem and a 10-year shorter lifespan. 30% of denture wearers can only eat soft foods. Not so with dental implants. Fact 4. Denture and partials offer short-term solutions. Studies show that within a 5-year period, only about 40% are still wearing the original partial or denture made for them. Dental implants offer a better long-term solution. Fact 5. With natural teeth, a person can bite with about 200 pounds of force. With dentures, your bite force drops to approximately 50 pounds of force. After about 15 years or more of wearing dentures, you can expect only about 6 pounds of bite force, seriously altering your diet. In conclusion, dental implants allow you to improve your smile, restore your facial structure, eat the foods you enjoy, restore chewing for easy digestion, speak with greater ease, enjoy an active lifestyle, and live with confidence. There are many factors to consider when choosing dental implants. The best place to start is with a no-obligation consultation with a dental professional. Why not make the call today to see if dental implants are right for you?